My interest in clinical psychology is one that I think has been with me since a very young age. Whether it was debating the efficacy or the ethics of using pharmacological methods to treat what are essentially behavioral problems, to asking the bigger questions about life in terms of what's the meaning and purpose of human existence, I've always been inclined to use questions about human nature to organize my own thinking and experiences in life. So it may come as no surprise that this tradition of inquiry is still very much alive in my current research at the Clinical Neuroscience of Schizophrenia Lab at the University of Calgary. So what I'm doing for the past few years, what I have been doing is researching people with schizophrenia to answer one very simple question, one very straightforward question. And that is, do people with schizophrenia or who have been affected by schizophrenia use visual facial information in the same way that you and I might? So for example, when looking at a happy face, are they noticing the upturned corners of the mouth? Or when looking at an angry face, are they using the furrowed brow in such a way that they're able to recognize that face and identify it as angry, such that they might respond to it in a socially appropriate manner? While this might seem like a fairly straightforward question, the answers to this question hold many insights into how these people who have been affected by schizophrenia are able or unable to navigate their social environments. Intuitively, these social skills are very important for effective social functioning in everyday life, most importantly in terms of fostering and maintaining an active social support network, and not only finding a job, but also keeping a job. So these are very important skills. And so consistent with other studies in this area, what my research has found is that people with schizophrenia actually do use different areas of the face in making discriminations about the emotional valence or the emotional state of that face when compared to a control group, which is important and a novel finding. Where people who have not been diagnosed with schizophrenia, or people like many of us in this room, will often look at the eyes in judging the mood of a face, people who have been diagnosed with schizophrenia tend to overutilize the nose and mouth region while ignoring or underutilizing the all-important or information-packed eye region. And what's really interesting about this is that the degree to which a patient uses information from a face differently from controls, so the degree to which they use it differently, is a good predictor of how poorly we can expect them to be functioning in the community, and that's also a novel finding. So what's really exciting about this research is that even though it's still in progress, future researchers can build on this by designing and implementing interventions on a behavioral level to essentially guide patients with schizophrenia to looking at the right or the most useful areas of the face. So doing that, looking at the most useful areas of the face in social interaction, should make them better able to predict what people are thinking, what people are feeling, and then also which will benefit them in terms of social and occupational settings. So in sum, where pharmacological treatments for schizophrenia are no doubt essential for recovery from the disorder, the symptom reduction that they offer is by no means a full treatment. So what we also need to reintegrate these people into the community through effective social functioning on a behavioral level. And my research is basically removing one roadblock to their success in that regard. Thanks.